Module 8.3, Hearing Loss and Hearing Protection, Part 2. Hearing loss in young children. Young children are prone to getting ear infections. Often the ear infection will occur without the child feeling any pain. Two signs that a child may have a middle ear infection are the child is rubbing or scratching at their ear, or the child loses interest in watching TV or videos and starts playing with toys instead. This is because videos are not very interesting without the sound. Detecting hearing loss in infants and toddlers is very important because language is almost exclusively acquired by hearing. This is especially important during a child's first 2 years of life. If hearing loss goes undetected for too long, a child's learning ability will be severely impacted. If an infant does not react to a sudden loud sound, they should be taken to an audiologist as soon as possible. If it is determined that they have sensorineural hearing loss, cochlear implants will probably be recommended as early as 6 months of age. Cochlear implants are sensors that are implanted in the cochlea and send signals to the auditory canal to permit hearing and the acquisition of speech. Overexposure to loud sounds. Here are 4 signs that you are in an environment with the potential to cause hearing damage. If you need to raise your voice to be heard. If you have trouble hearing someone who is 2 feet away from you. Speech sounds muffled. You experience pain or ringing in your ears. It is advisable to listen to sounds at low levels rather than at a high level. Once sound levels reach 85 dB, you are in jeopardy of having some sort of hearing loss. OSHA, the Occupational Safety and Health Administration, has set guidelines for what is considered safe sound level exposure. Listening to sounds longer than indicated on the table can result in temporary or permanent threshold shift. Notice that every 5 dB increase in SPL reduces safe exposure time by a factor of 2. So when the SPL is 100 dB, you should limit exposure to 2 hours a day. Raise the SPL to 105 dB, and only 1 hour is considered safe. Consider this. With the volume of an iPhone set at 3/4, the SPL of a typical set of earbuds is 105 to 112 dB. How long do you listen to music every day? What is your typical volume setting? Are you endangering your hearing? It turns out there is an epidemic of hearing loss in young people because of their personal music listening habits. There are more details in 4 YouTube videos in this module. How do you protect your hearing? If the SPL in your work environment regularly exceeds 85 dB, you should consider some form of hearing protection. Foam earplugs are one solution. Foam earplugs are good for 20 to 30 dB of noise protection. They are cheap, easily available, and washable. If you are a musician, you may want to get molded musician earplugs, which have a better frequency response. If you are a worker in a loud environment, an airport, dance club, firing range, construction site, landscaper, over-the-ear protection is recommended, which can give 20 to 45 dB of reduction. For better protection, use both foam earplugs and earmuffs to get 40 dB of protection over a wider range. To review, hearing loss is an inability to hear. Hearing loss may be partial or total. Deafness is an inability to understand speech. Profound deafness means there is no hearing at all. Symptoms of auditory fatigue are sounds appear to be muffled, it's hard to hear someone speaking to you a few feet away, or sounds appear to be softer than usual. Noise-induced hearing loss is caused by repeated exposure to loud sounds. Noise-induced hearing loss is usually centered around 4 kilohertz. Presbycusis is a hearing loss of high frequencies due to aging. Children can usually hear up to 20 kilohertz. Adults have an upper limit of 10 to 14 kilohertz. And by age 70, most people have an upper limit of 8 kilohertz. Tinnitus is hearing a constant sound that is not produced by something outside of your head. Conductive hearing loss is due to a problem in the outer or middle ear and is usually temporary. Sensorineural hearing loss occurs in the inner ear or with the transmission of nerve impulses to the brain. It is usually permanent. Sensorineural hearing loss is usually confirmed by using a bone conduction test. A young child may have hearing loss if they are rubbing or scratching at their ear, lose interest in watching TV or videos and start playing with toys, or do not react to loud sounds. Cochlear implants are recommended as early as 6 months for infants with sensorineural hearing loss. There's an epidemic of hearing loss in young people from listening to music with earbuds and at concerts with high sound pressure levels. If you are regularly exposed to sound pressure levels above 85 dB, you should use hearing protection.